Patrick Mahomes getting ready for the Super Bowl, and then on Saturday somehow injuring himself or getting COVID, not being able to compete. I mean, it's that level of intensity and meaning to these athletes.
Yeah, I think that's something we could all relate to. Patrick Mahomes wasn't able to make it to the game due to COVID. Tell me, if you can, describe what, this is our second time going through the Olympics during this pandemic. Describe the difference between then and now. Are we getting close to being back to pre-pandemic Olympics? Dr. Harrell, your thoughts?
Yeah. So hopefully, I think, the preparation for winter was a little smoother than the summer games as far as the logistics go. Again, there's so many unknowns and also just the reality of the situation. But, I would say, while you're there, certainly when you're around in the outside operation component and traveling to and from different venues, the airport, it is a really off feeling. But, once you're in the village and once you're in the competition venues, it really was still an incredibly special event and with camaraderie and kindredship and competition. And from that standpoint, it felt like any other game.
For both of you, what's it like training an Olympic elite athlete?
It's fun. I mean, to say it from an optimistic standpoint, I mean, it is. The very goal driven, obviously. The intensity that these athletes dedicate to their sport is just amazing. Very enjoyable on all of them, and they're all just every athlete I've worked with has just been an amazing person all around.
Dr. Harrell?
Yeah, it is a lot of fun. I feel really blessed to have been in the positions I've been and am in. It's an honor. It's an interesting population. They know their stuff. They're very in tune to what you're recommending and vice versa, what the expectations of you are to meet them at that elite level. And so it's been a blast.
Well, let's talk about some of our local aspiring male and female athletes. Tell me a little bit about how you use your skills working with those elite athletes to work with some of our local kids.
Really take the same approach. Because again, especially when an athlete, the idea is to give them a very well-rounded care, whether that's, helping them get past an injury, whether that's helping them how to move faster, stronger, help with nutrition. I mean, so that the tactics we use to help our Olympians be the best that they can are applicable really to any level. And sometimes that's a hard part too, is because you don't have experience, with a young athlete. They can be grade school to junior high, especially as they're going through puberty. There's a lot of body changes, and so they need a lot of guidance going through that. So really, it's just a matter of applying those same techniques to help your athlete at any level.
Dr. Harrell, you care for our KU athletes. How do you use your skill with those athletes?
Yeah, I think as Dr. Elm just mentioned, a lot of it is the same, I suppose. But I think one of the advantages we have for being in these different arenas is, we have exposure to an entire network of experts and elite providers throughout the sports medicine field, and that allows us to really bring some of those cutting edge, the excellence that is expected by our athletes. We have the fortunate opportunity to have those resources and experiences.
So what's the takeaway for all of us average people? I'm very average. So what would be the takeaway? What kind of advice do you have for people just on a sports level? The weekend warriors to the kid athlete. What's your advice? I'm sure you get asked that all the time. And just what's some good takeaway advice? Certainly during this pandemic.
The big thing is have fun. I mean, that's the point of athletics. It is, there's a lot of stress that goes into it at elite level, even, at the local level, but ultimately sports are meant to have fun, whether that's you're a spectator, you're a participant, you're a weekend warrior. Have fun, do it safe, and just that's part of enjoying life.
Don't take yourself too seriously. Dr. Harrell, as we get ready for the Big 12 tournament, what kind of preparations are going into that? We certainly remember a couple of years ago, that's when things came to a halt when this pandemic hit. What type of preps go into getting those athletes ready and certainly staying safe during this time?
Yeah, so we have a weekly meeting with team physicians for the Big 12, and it's a very extensive review of all the policies and procedures that are going to have to take place to keep everybody safe and healthy, let competition go on. We have to continue to, from an educational standpoint, reminders to our athletes, our coaching staff, administrative staff that, we're still dealing with, this pandemic and what some of the consequences may be of testing positive or exposures. And so, there's fatigue throughout society with, feeling like we're coming out of this, but it's real. And so we have to continue to grease those wheels and push on, knowing, kind of what things to look for and what things to avoid. So we can keep everybody healthy and competing.
So we know staying active, of course, is important to keep us healthy. Dr. Alm, your thoughts on just how parents and younger students can stay healthy as they get back out onto the courts and the fields. And I know I'm still struggling to get my kids back into gymnastics. I think we've lived a certain way for 2 years, and it's hard to kind of know when to go and when to pull back. Just what advice do you have for parents to be able to keep their kids out there active and healthy?
I think a big part of it, and I know Dr. Hawkinson talks about it, but the pandemic isn't over. And so it's a matter of making sure that we're doing things safely, especially if you have a child that is an athlete that wants to stay active. Obviously, the goal is trying to limit exposures as much as possible. And so finding ways to do that maybe outside of the sport to keep them going. But again, some of it is basic hygiene. Wear your mask, have a good nutrition. These are things that help the body stay strong and try to keep your immune system up if you do get sick.
So I have to ask you, we're going to turn back to the Olympics. Dr. Harrell, what's been kind of some highlights from the Olympics so far? We got closing ceremonies coming up in just a few days. Your personal faves?
Well, I couldn't say that. I was fortunate to take care of these athletes throughout this last 4-year cycle, and I would say to the audience as a whole, as getting to know them personally and spending so much time and watching their journey and their ventures through what they've had to deal with. It's not glamorous. 3.5 years leading up to the Olympics, and I can't tell you how much pride I take in knowing what they've been through and seeing them succeed. So no personal favorites, love them all.
Love them all. And Dr. Alm, same question though. When you do this, like you said, this is not easy work. It's not all the glamour. It's not those couple of weeks that we see on television. It's the hard work and the grit that goes into it leading up to it. But when you finally get a chance to watch, what are those moments that make you go, wow, I've watched these athletes grow and get there, and now they're here. What's that emotion like for you? What stands out in your mind?
It's the grit, honestly. And, when you ask Dr. Harrell that question, there was an athlete which I think epitomizes the dedication to the sport. It was a female Italian skier, Maggio, I think it is. Maybe I'm saying her name wrong. 3 weeks prior to competition, she has a partial tear to her ACL and a fracture to her fibula. That was 3 weeks ago. She came out with a silver. And so, again, all the athletes are phenomenal. But, again, that was an instance where even though she wasn't a Team USA athlete, really was amazing. And if you happen to find video and watch it, you can see that she's basically skiing on one leg just so she can compete. It was phenomenal. And, again, I think it really shows the spirit of the games and the grit that these athletes have and the love for their sport.
Yeah, I think us average people would just call it a day. Let's just pack up and go home at that point. But you're right. Nobody's going to make it all the way there and say, by golly, I'm going to compete. If it's the last thing I do, even on one leg, I'm going to do it. I do want to ask you, though, about something, Dr. Alm and Dr. Harrell, jump in as well, just if you have any comments on this, because we were talking a little bit before the show about this. There's always a little controversy. So the Russian skier, the Russian ice skater, Camilla, and the issue with the heart medication that she was taking. Tell people a little bit about that, and from a physician perspective, when a physician is tied to an athlete, and what that all really ultimately means, and the responsibility that doctors have when you're dealing with a 15-year-old athlete.
There's a huge amount of responsibility, and that's probably one of the most serious parts of being a physician for this level of athleticism. There's controversy about the medication she had been taking. There's a lot of it. She's 15, and a lot of times these athletes, their focus their main purpose is to focus on their sport. It's kind of the entourage with the physician included that we take the responsibility of making sure they're doing the right things. When in training or when I travel with the team, I double check all the anti-doping regulations beforehand. Before we leave, look at what's allowed in competition, what's allowed in training, before even giving anything to an athlete. We have to take the utmost care about it, and the athletes know that as well. I mean, to a point, when we travel overseas, we try to limit our athletes to eating, at least before competitions, before they might get tested, to only eating in the hotel or where they're staying at, so we can actually do tracing of where meats will come from, foods will come from, because there have been in the past where we've had some contamination of medications given to livestock that will pass through to the human. And so at least if we know where they're eating at, we can trace it. So again, that's how serious it is when we're talking about keeping our athletes safe and out of trouble.
Yeah, Dr. Harrell, of course, we like to stay in our lane when it comes to these kind of controversies. But from your perspective, I mean, certainly the highlight and the spotlight gets put on the athlete, but there's so many people behind that athlete, like Dr. Alm said, that have that responsibility to make sure that they're getting the right medication if they need it. Just from a physician's perspective, what are your thoughts?
Yeah, as Dr. Alm mentioned, I mean, the first thing I was told 8-9 years ago when I first started working with the Olympics is and Team USA is look up every single medication. And I can say, as Dr. Alm mentioned, I don't care how basic of a medication it is. You literally, there's a website that we all use that's one consolidated. You go to it, sport, pre-competition, in competition. You verify it, and literally you show the athlete, this is what I'm writing you. This says not prohibited. Athletes want to see the screen themselves. They are just as paranoid, if you will, as we are, that you're going to make a mistake, and the consequences are dire. So when we're talking about whether it's in this particular case, if it's a minor or an athlete who maybe is a young adult that really doesn't maybe look at everything through the same lens that we do retrospectively, this is one of those things that everybody knows about. You don't put anything in your mouth, literally, without asking, is this okay? So it's a challenge when you see positive tests, and there's always going to be questions as to why they didn't know. And as Dr. Alm, I mean, we mentioned we look at water sources, food, all the things that was just mentioned, for any contamination in the ice. We don't let them use ice from a hotel because there could be something in the water source that could get them busted. So again, it's always difficult to understand when these things come up positive, how that happens.
Now that is interesting. I don't think a lot of people knew that. Did you know that, Dr. Hawkinson? All those testing and the ice and the water? I don't know. Am I the only one that didn't know that? But I think that's why those questions come up, is because everything is so well checked that you're thinking, how did this get passed? So whole other topic, whole other conversation. But I thank you for that perspective, to know what those doctors are doing to make sure that nothing's getting in those athletes without people knowing it. I want to get to a couple community questions. Dr. Hawkinson, got a couple for you. Rebecca's just curious, can you give an update on monoclonal treatment in hospitals? I know there was some trouble getting them. Where are we at?
Yeah, I mean, overall here at our health system, we've had a decrease in the utilization of those monoclonal antibodies for treatment. Again, these are only for outpatients. Really, the best thing is if it's 7 days or less from symptoms, that is when they have the most effect. But we've seen overall a decrease, probably because of the overall decrease in cases. We do have supply right now. We are also getting supply, it should have been shipped on Monday, from the federal government, a supply of the other new authorized monoclonal antibody as well. So we should have 2. We'll see how that goes within the next few weeks, but overall our infusions have gone down considerably from where they were 2 and 3 weeks ago.
All right, and Deb has a question. Should someone with COPD that is 6 months out from a booster shot get another booster?
Yeah, again, right now there's no data about that, about getting a second booster if you've received your first 2 doses and then that third dose, that booster. There really is no data right now for that. I think we are waiting for the Israeli data. We know the VA system has produced really good data as well. So right now there is no indication or recommendation to get a second boost, if you will. So that would be a 4th dose if you are non-immunocompromised. Remember, if you are immunocompromised, you need those 3 primary doses and then that 4th dose, which is your actual booster. But if you are not immunocompromised, it's really just those 2 primary doses and then that 3rd dose, which is that booster. And there's no recommendation beyond that at this point in time.
Well, you got to at least appreciate people wanting to get more shots.
Yeah,
We're trying to get people to get 1 shot. All right, so we're going to get to our final thoughts. So glad to have Dr. Harrell and Dr. Alm with us this morning. Dr. Harrell, just some final thoughts from you. What do you want us to know as we head into some good, fun spring sports?
Well, I'd like to kind of touch finally on that on the Winter Olympics and kind of what I mentioned there, like just how much these athletes do in preparation, sacrifices they make. I'm also astounded by how much pride they take in representing our country while we're other places, and how they act and behave as an entity and a delegation, and I hope again we as the audience can appreciate that and take as much pride in them as they do us.
Thank you so much for being with us today. Dr. Alm, I want to get your final thoughts, but I have a quick question from Joellen that I do want to ask you. She was asking what it's like to work with young adults, and at what age could their bodies be considered adult bodies?
Mm-hmm. A lot of that depends on the individual. Even just from a simplest term, there's a lot of certain markers we see on an x-ray that show bone maturity. And so, from a simplest term, but it's hard to tell because everybody ages at a different rate. And so you really need to take each athlete as truly as an individual. Obviously there's ranges, kind of think of it somewhere between the ages of 17 to 20 is where you start hitting close to full maturity. But again, every athlete is a little bit different. So there's a multitude of factors that we take into account when we're dealing with athletes, especially those who, right now, as we're getting ready for the next games, what we would consider as we're getting ready for Junior World Championships coming up later this year, we're dealing with athletes who are about 15 to 17 years of age, depending on the sport. And so, again, it does make it interesting because it's not just a single age group that we're dealing with.
Makes sense. Final thoughts from you. What could all of us average athletes take away from today?
Just enjoy it. And like Dr. Harrell says, whether that's enjoying watching the Olympics, whether that's enjoy watching football, the upcoming baseball season with the Royals, the point of athletics is to have fun, to either really take pride in those that are representing you, your country, your city, whatever it might be, but also if you're an athlete yourself, even if it's weekend warrior, have fun doing it. That's the point of sports.
Thank you both, and thank you so much for taking care of care of our young athletes here in our area. We appreciate you so much. Dr. Hawkinson, final thoughts from you today.
Yeah, it's been good to work with Dr. Harrell recently with KU Athletics. I look forward to working with you in the future as well. And I think individually, we want to keep our athletes, our children, our people who are active active. And I think the best way to do that is to continue to get vaccinated. We know the immense complications that occur if you get the infection versus if you get the vaccine, where your complication rate is extremely or much, much lower. So it continues to be important. We heard some of the comments today about how to keep athletes and their families safe. And the way to do that is what was said, identify those areas that you're at, but try to stay active. But the best thing to do also is to continue to get vaccinated, be up to date with that vaccination. So if you're due for a booster, get that booster as well.
All right. Well, in about an hour, we are launching a brand new show. It is called All Things Heart. And as the title suggests, we are focusing on everything and how it comes back to the heart. My coworker and good friend, Alexis Del Cid, is hosting the show, and she joins me now. How are you? Good morning.
Doing well. Good morning, Jess.
A lot of hard work. I know
Yeah.
you put so much, lots of research and lots of time, and we're thrilled.
It's fascinating because every single health discipline has a heart connection.
That's
and
right.
so we're going to get into that throughout each new episode. And we have a COVID episode coming up after this. And we're going to have Dr. Hawkinson as one of our expert guests on as well to talk about that.
All right, I want to get to a little bit more of the preview of your new show coming up here in just a bit. But first, I want to get a little preview on you. Tell us a little bit about yourself and your Kansas City connection.
So my husband and I and my son were so happy to be back. We fell in love with this city when we first moved here a decade ago. I was the morning anchor at KCTV5 for many years. I also hosted Better Kansas City, which was delightful. Met so many amazing people here in the community. My son and my husband and I are just in love with Kansas City. It was our first Chiefs game since being back. We love the Chiefs. More thrilled just to be here at the University of Kansas Health System, working with such brilliant minds and fun people, and everybody in our newsroom here has a TV background or a print background or journalism. So I know you came from the same place I did, working in TV news. So it's just been awesome. It's felt like such a good jump into the next adventure.
It is. And are you enjoying getting to know? I know when I first started here, it was like, wow, I thought I knew a lot until you come to a hospital and all these smart people and all this medical lingo, but
it's fun.
How are you dealing with it?
It's fun. It's and everyone's so gracious when you ask how to pronounce something, or you call something a lab coat instead of a white coat. And so I'm learning as I go. It is, and sorry, Dr. Hawkinson, for calling it a lab coat when I first met you.
That's what I know. Dr. Stites, I always have to just say, Dr. Stites, Dr. Hawkinson, I'm going to say something, and I'm going to mispronounce it.
It's a whole different language.
It is.
So it's cool, and it'll be cool to meet viewers in this own way. So in an hour, we
About
have
an hour.
our
Yeah,
first
so
episode.
10 o'clock, All Things Heart debuts.
Yep.
What's on deck today? What's the first topic?
You're going to meet two incredible women, Jess. They are two women who are suffering horrible heart complications 2 years after they got sick with COVID. They're not alone. They're among a growing number of long haulers who now have heart troubles. And these ladies were in perfect health before they got sick. One was a fitness instructor that I regularly interviewed when I hosted Better Kansas City, and now they have these horrible heart complications from COVID. We're also going to have 3 doctors to help guide us. We're going to have a cardiologist, a specialist in the long haul clinic, and of course, Dr. Hawkinson will answer all your viewer questions as well. So that's coming up in about an hour at 10 a.m. on All Things Heart.
All right, can't wait. I'm going to go fill up my coffee, wrap this show up, and get ready to watch your show.
I'm so excited.
Every Thursday at 10 a.m.
Every Thursday at 10 a.m.
All right, we
Yes.
will be watching. Good to meet you, finally, on air.
On air.
On air.
We've been spending a lot of time
We
together
have.
off air, but
we sure have.
great.
All right. Well, thanks for everyone for being with us today. Thanks to our great guests. And don't forget, you can catch our shows anytime by logging onto Facebook and on our YouTube channel. Coming up tomorrow, spring sports season is gearing up and many players are returning after COVID or some type of possible injury. What you and your kids need to know before the season kicks off. Plus, it's also a big day as many in the Metro get ready to buy their tickets for the Royals 2022 season. We're going to talk spring training and take a look back at the Chiefs season. Everyone have a great day.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts are available.